Greetings, colleagues. Thank you so much for joining us for yet another webinar. In Kenya, we say jambo, and in South Africa, we say sanibonani. My name is Spangile Msweli. I'm a senior manager of the Youth Leadership Program at the African Wildlife Foundation. I'm a South African based in Kenya and happy to be moderating this dialogue today. It's been roughly more than 2 years since COVID-19 was identified in Africa, and it's about 18 months since, as the African CSO's Biodiversity Alliance, we hosted a series of webinars, launched infographics, and released a video warning, or rather educating on the risk of zoonotic diseases on great apes. Today, we reflect back on how far we have come as a continent in protecting great apes against COVID-19, but also any other zoonotic diseases. I'm, of course, no expert in this topic, but I am joined by a panel of leaders who work in the space. We have Dr. Gladys from Conservation Through Public Health. We have Praveen, who will be joining us shortly from Volcanoes Safaris. We have Dr. Emmanuel from the Wild Chimpanzee Foundation, and we have Dr. Johannes from the Great Apes Survival Partnership. Thank you so much, colleagues, for accepting my invitation, and I look forward to your contributions today. Now, for those who do not know, the African CSO's Biodiversity Alliance, in short, Agba, is an alliance of more than 100 CSOs that came together early 2020 with the aim of amplifying the African voice, mostly in global processes. But the strength of the alliance is our members who come with the diversity of a lot of spaces that they work in. And as such, we also do a lot of awareness in the different areas where member organizations work, such as the campaign that you see today. If you would love to learn more about the Alliance, you're welcome to follow the link in the chat box that my colleagues have shared, and also check us out in our social media pages. But today, we are here to do a follow-up webinar from a series of Securing a Future for Great Apes that we had more than a year ago, as well as relaunch a policy brief that was actually drafted with the leadership of Conservation Through Public Health and the International Gorilla Conservation Program, CTPH and IGCP, respectively. Now, if you haven't seen this policy brief, you are more than welcome to also check it out. My colleagues will be putting the link on it. You're welcome to download or reshare it in social media. But of course, we are going to get to hear a bit of the content that is in it in this webinar today. A lot has happened since the first version of the brief was out, and that is why it was important to come back again and reflect on how far we've come. This policy brief is intended to inform governments, donors, tour operators, tourists, and other stakeholders about how they can enforce and make use of the IUCN guidelines for great ape tourism across all the countries that have great apes in Africa. Now, to put this a bit into context, because videos usually tell a better story than me narrating it to you, we would play a short video that we had created last year on this topic. And of course, my colleagues afterwards will share the link to this video on YouTube, where you're welcome to use it as well. Jonathan, I would love to invite you to play the video for us.
A touch is an invitation to get to know each other. But is it
Jonathan, I think you have the other video.
Touch is an invitation to get to.
Thank you so much. And so sorry about that. Also inviting my other colleagues to share that video in the link to the YouTube one in the meantime, as Janvan plays for us the video that we have prepared for today. And again, just to also inform you colleagues that we do have live translation to French as well. If you would love to make use of that tool, you can go at the bottom of your screen where it says translation. You click that and you can either choose English or French, depending on which language you would love to follow the session in. I see some of our colleagues are currently unmuted. Please do remember to mute yourself unless you're speaking, and you will definitely get that opportunity later. Janvan, I see now you have the video. I'll go back to you.
Three out of every 4 new infectious human diseases come from animals. COVID-19 is one. Ebola, SARS, West Nile and Lyme are others.
12 out of Africa's 54 countries have reported cases of coronavirus.
These are zoonotic diseases, and they are very common. Hundreds of thousands of people have died. But it goes both ways. We give our diseases to animals. When the animals are great apes, closely related to humans, the result of infection can be disastrous. In fact, disease transmission from humans poses perhaps the greatest threat of all to many great ape populations. Over and over, African primates have become infected with human disease, from the common cold to pneumonia. As a result, many endangered animals have died. Human visitors could pass on a disease that could wipe out an entire population of great apes. Tourism brings huge benefits to economies, communities, and conservation efforts. But we must protect them. In doing so, we protect ourselves. Here's how. When visiting great apes, stay at least 10 meters away. Wear a mask. Support nearby communities to improve sanitation and hygiene. Tell tour operators and governments to enforce these rules. It could save their lives and yours.
Thank you so much, Janvan. And yes, colleagues, now that we have the background of the context of what we are discussing today, Dr. Gladys, I'll start on your side. Although this is a follow-up, I'm aware that we may have people who are joining us for the first time. So kindly explain to us, what exactly are great apes? How many species of them do we have in Africa? And what are some of the challenges that they face?
Great apes are species that are very similar to us. Even as humans, we are also great apes. There's actually, I would say in Africa, we have, I'll even call it 9 subspecies of great apes. So we have the eastern, starting off with the gorillas, we have 4 different subspecies of gorillas. There's the mountain gorilla, which is considered, it's the only actually endangered gorilla species, because All the others are critically endangered. There's just over 1,000 mountain gorillas left in the wild. And then there's eastern lowland gorillas, which are found in DRC. The mountain are found in Uganda, Rwanda, and DRC. Then there's eastern lowland gorillas, only found in DRC. Then there's western lowland gorillas found in Central Africa, including DRC, Cameroon, Gabon, Central Africa, and other countries, and Nigeria. And then there's the cross river gorilla, only found in Nigeria and Cameroon. And then with the chimpanzees, there's the eastern chimpanzee, western chimpanzee, and the bonobos beings. We're another of the great apes. And the biggest threats to the great apes are the non-human great apes. Habitat loss is a very big threat due to very high human population growths. People are cutting down trees for firewood just to survive. And then poaching is a big threat. The bushmeat trade is a big threat in most of the 10 countries, actually the 26 countries in Africa, 21 countries that have great apes. But also another big threat is disease. And that is why we're here today. We're trying to see how people who are closely related to the great apes can visit them without making them sick, because we really need that money from tourism to sustain their conservation efforts. But because we're so closely related, we can easily make each other sick.
Thank you so much, Gladys. And actually, thanks for quickly making that link that we do need the revenue from tourism to protect the great apes, but at the same time, there could be challenges that come with it. Dr. Emmanuel, you work in West Africa. What are some of the challenges? Are they almost similar throughout when you look compared to East Africa, for example, where Gladys is coming from? And what are some of the issues that you mostly deal with in the region where you work?
Okay,
I think,
sorry.
Yes.
Hi, everybody, and I'm sorry. I'm sorry, my webcam is not working. It's being very difficult this morning. So, I work for the Wild Chimpanzee Foundation, and the Wild Chimpanzee Foundation works in 3 countries in West Africa, Guinea, Liberia, and Côte d'Ivoire. I mean, each country and each area has its own challenge, and the conservation action then are totally different from one country to another. For example, in Guinea, there are still many chimpanzees, a lot of chimpanzees, but they are disappearing every day because they are not in protected area. And there is a huge development in the country with dams, creation, mining areas, and roads. And in this country, our main focus is to create protected areas where we can maximize the number of chimpanzees, the intact habitat, and minimize the number of people impacted by the creation of these protected areas. In Liberia, the situation is slightly similar, but the challenge is greater because in Liberia, but there is only few protected area, but there is lots of forest, and hunting is the main activity because there is no development, no roads, no agriculture, no employment, or it's not no employment, but it's like only few. And because of poaching and uncontrolled logging, then the forest and the chimpanzees are disappearing. So in Liberia, creating protected areas is a priority, but the investment is huge, but because at the same time, law enforcement and development has to be set up at the same time and set up quickly so we can stop now the disappearance of chimpanzees and other species. But in Côte d'Ivoire, where I'm based, the situation is completely different because in Côte d'Ivoire, there is a huge network of protected areas, of classified forest, of national parks. But these protected areas in the forest zone have totally disappeared because of deforestation and being replaced by mainly cocoa. And chimpanzees, I mean, in this area that were replaced by cocoa, you can imagine that there is no chimpanzees anymore. In one area where I worked in more than 10 years ago, we've seen 150 people coming in with weapons to farm cocoa. At the same time, we lost 250 chimpanzees in like 3 to 6 months. So deforestation kills very, very, very quickly. So we are working we have abandoned this classified forest that disappeared, and we're trying to save the one next to Thai National Park, the Cavity Classified Forest, mainly right now with the law enforcement. Supporting the law enforcement in this area. So there's only Thai National Park, which remain intact forest and the largest protected area in West Africa. But in this area, because of poaching for many, many years, the wildlife population has decreased a lot. And we have developed ecotourism as an alternative for the population, but also to set up the permanent presence that has been shown to really make the difference, as you show in your video, to make the difference and for conservation. And now we have one community-based ecotourism site in Thai, and we're supporting another ecotourism site south of the park, where we're supporting the habituation of chimpanzees to ensure that the guidelines are implemented and that chimpanzees are properly followed. So the challenges are huge, and I think there is not one solution, but according to the literature, and as we have seen also in our work, the central actions to protect great apes are law enforcement in protected areas and supported by permanent presence that can come from research or ecotourism. Thank you.
Thank you so much for that information, and actually reminding us that even though we have these broad challenges, they would usually differ per site as the local context is different. But actually touching on the nexus between conservation, development, you've touched a bit on agriculture as well and the role that it played. Dr. Gladys, I'm going to go back to you. When we spoke more than a year ago, there were no reported cases of great apes conducting COVID-19, be it in the wild or in captivity. And of course, we wrote this policy brief and this campaign exactly recognizing the relationship that we have with great apes. Has there been any developments into this? Have we seen either in the wild or in captivity great apes getting COVID-19? If yes, how are they reacting to it? Do we have enough to know? Yeah, back to you, Gladys.
Yes, when we had the webinar in October 2020, we strongly suspected that great apes could contract COVID-19 because we share the same protein receptors that the SARS-CoV-2 virus likes to attach to, the one that causes COVID-19, so the AECE2 protein receptors. And we were all very concerned about it. And then in January 2021, it actually happened. Captive chimpanzees, captive Western lowland gorillas in San Diego Zoo actually contracted COVID-19 from a symptomatic keeper. I think there were about 8 of them in the group, all got sick, and the aged silverback of 48 years old actually needed monoclonal antibodies to get better. The rest received vitamins, antibiotics, fluids, but the aged silverback needed more intensive treatment to recover. And then a month later, there was also a case, a couple of gorillas in Czechoslovakia, in the Prague Zoo in Czechoslovakia also got COVID. And then in August 2021, I believe, August or September, gorillas in Atlanta Zoo got COVID, but which was scary is they seem to have acquired the Delta variant from a vaccinated asymptomatic keeper. So yes, since that time, it's been a very big issue. And as we can see, the way that the great apes reacting to COVID is the same way that we are. You know, they range between mild, moderate to severe symptoms, and the ones that are aged and immunocompromised are more likely to be affected. So this is all the more reason why we have to be very, very careful and know that, COVID can easily spread between us, and not only COVID, but other respiratory diseases.
Thank you so much, Gladys. And of course, this is part of the new content that we now have in the policy brief that we didn't have in the first version, which was drafted before these developments. Johannes, I'll go to your side. Emmanuel touched earlier on the need to enforce guidelines for tourism. And you yourself had touched also on the last webinar that we really need tourism to generate some of the revenue. But what exactly are these guidelines, and whose responsibility is it to implement them?
Yeah, thank you. Let me first maybe explain the motivation for having guidelines. You said already before, tourism plays an important role in many countries and generates a significant contribution to the national economy, but also to the local economy. So no income from tourism makes it difficult for protected area authorities to maintain their operations. It might also make it difficult for community members just to pay their health bill. And if they're not able to pay their health bills, it even creates a bigger problem. So a couple of years ago, the ICN Primate Specialist Group section on Great Apes started to develop best practice guidelines for tourism. And the whole idea was to allow tourism, but do it responsibly and to minimize impact on great apes and minimize the risk of disease transmission. So what is in those guidelines? So first, even the ICN Primate Specialist Group recommend to wear masks when approaching great apes, and that should be applied by visitors, guides, researchers, everybody getting very close to wild great apes. They also recommended a minimum distance of 7 meters and a maximum number of tourists visiting great ape groups of 8 visitors per group. So now with the best practice guidelines, we are suggesting, and based on our experience with the crisis, we recommend to increase the minimum distance to 10 meters and to reduce the maximum number of visitors per group to 6 instead of 8. There are other recommendations in the policy brief too, because I think we have to look beyond just the tourism element. We have to make sure that communities and protected area authorities can generate income when there are no tourists, because it's important. So we also recommend to look into a diversified economy around wildlife and around great apes. And actually GRASP is looking and will be looking into some alternatives in the form of wildlife credits so that communities and protected area authorities can get compensation for the animals they keep on their land. There are other elements which are also important, are not yet reflected in the policy brief, but I think they're equally important. The same way as tourists can come to the great apes and bring diseases and get exposed to diseases, the same happens with development projects. We often build, and Emma talked already about this, we build roads deep into the forest. We have mining operations. We bring workers from very far with new diseases. They might get confronted with new diseases. So what I think is we also need to look into wildlife and human health monitoring to establish baselines in intact ecosystems and really to monitor when development happens and see what is the disease risk. And that is really relevant for big development operations and should be included in performance standards of the lending banks. That goes beyond the brief, but I just wanted to open that discussion. So now you're asking, whose responsibility is this? I actually am a bit provocative and would say it's all our responsibility. Yes, first, of course, it's the protected area authorities who manage great ape tourism, or communities if the great apes are on their land and they manage those operations. So we hope that they can roll out those recommendations. But it's more, and we will hear more from Praveen as a responsible tour operator. It's also the tour operators who have to educate their clients and make sure that rules are properly followed. And at the end, it's all of us, because I believe we are privileged. Many of us have seen great apes in the wild. We speak to friends, to colleagues. We encourage them to see great apes. We should make sure that the expectations are correct, that they follow the rules, And we definitely don't want to raise the impression you can go to the forest and cuddle a gorilla. That's not what we want. So we have to be careful also with the photos we share. And I think the last question was, have we been successful? I'm a bit hesitant to answer that question because it's very difficult to assess from a scientific point of view whether we have prevented disease outbreaks or not, because we haven't seen it. But it gives me some positivity to see that since I think July, August 2020, gorilla tourism has resumed in Uganda and Rwanda, primarily on a local and resident level, but people go to see gorillas. We have not yet seen a case of COVID-19 in a wild population of gorillas. So it gives me some hope. I don't know how much we have prevented, but gives me some hope. So let me close with a relatively positive feeling. Thank you.
Thank you so much for that last positive feeling that fortunately we haven't had a recorded case yet in the wild. I mean, Praveen, Johannes has already started referring to you. You are a tour operator. Tourism is reopening as the travel bans, most of them to some extent have been lifted. When you receive tourists, are you actually finding that they know about these guidelines? And also perhaps on the other side, what are you doing or what's your role as a tour operator in educating them about these guidelines? Does your role start once they arrive in the country or way prior? So over to you, Praveen. Quickly checking if you can hear me. You are muted in case you are speaking.
Can you hear me now?
Yes, I can hear you now.
Sorry. Good morning, everybody. Good morning, Simanjele and everybody else. Sorry to be a bit late. But possibly the reason might be interesting. I'm at Virunga Lodge in Rwanda. We're a few miles from the Virunga volcanoes, which, as you know, is the heartland of the mountain gorilla habitat on the border of Rwanda, Uganda, and the DRC. And of course, the Park of Bwindi in southern Uganda is not far away. And I've driven up from Kigali this morning. And on the way, I've stopped in the town of Musanze, which is a couple of hours away from Kigali, as many of you will know, in order to have my COVID test. And the reason I've had a PCR test this morning is because on Saturday, I'm going to Uganda. And here I am at Virunga Lodge, and behind me you will see some panels of an exhibition. We are in the Dian Fossey map room at Virunga Lodge, which we built 5 years ago at this lodge in Rwanda to celebrate the work of Dian Fossey and all the other conservationists who have made gorillas happen, so to speak. Obviously, before the conservationists started, as you know, it was the administrators in the late 19th century and the early 20th century who mapped out this area, who worked out the volcanoes. And in 1902, was a recognition the presence of the mountain gorilla in the Virunga volcanoes. And we're 110 years from that date today. So it's a great time to review all these issues. And of course, as Simanjele said, we had this seminar about a year ago as well. What is our take from that? It's almost 2 years since the pandemic started. All of you have seen how it's developed in the different countries you are involved in. It's been challenging for all of us in personal terms, in family terms. Many countries have seen many deaths, many economic issues and social issues and isolation. But again, as Johannes said, I think now we are at a phase where there's some optimism that maybe it will stabilize and we will be coming out of it at some point. What has been our take in as a lodge operator more than a tour operator? We have, as you know, Virunga Lodge in Rwanda and 3 lodges on the Ugandan side to do with gorillas and chimpanzees. Well, obviously, we all had to close in March 2020, and we closed very rapidly. In July 2020, we reopened in Rwanda, and in October 2020, we reopened in Uganda. So it's now quite a long time that we have been open. And I'm happy to say during that time, we have had a steady trickle of guests living in Rwanda. That's Rwandese guests and international residents who are expatriates here, as well as international guests. I think we have been luckier than most that people wish to travel. The mountain gorilla and this area is very important to them. And we've had many people coming here over the last 2 years. Of course, it's nothing like our normal numbers, but the lodge has been able to operate, and we've managed to continue with our staff and managed to offer our services. But as you asked, Simanjali, what are we doing about the COVID story? Well, from the very beginning, we've tried to follow all the guidelines that have been put out. One, of course, is the individual guidelines put out in the countries of Europe and America, where primarily our international guests are coming from. And so people who come from there have to follow those guidelines. Then, of course, there are the arrival guidelines, whether in Rwanda and Uganda, and in the case of the DRC, where we don't directly operate, people obviously have to follow all those tests. And then as a lodge operator and as a vehicle operator, we also have to follow all the guidelines for COVID for our guests, which we have done. And also, of course, the IUC and park guidelines. And so these 4-stage guidelines that apply to the world, we have made sure we disseminate them to any guest who's inquiring to come here at the first stage, so they're fully aware they'll have to follow these protocols. Secondly, when they arrive, our guides brief them. And thirdly, of course, the local authorities also brief them, the national authorities. And at our lodges, we've had social distancing in place, we've had limited numbers of people, we've had all the washing protocols. So I'm happy to say that this has worked well so far, touch wood. And when they've gone to the parks, again, we have done our pre-briefing for them to follow those guidelines, because I think, of course, it's crucial that we all work together and follow these guidelines and make sure that people are aware of them. We have had cases of COVID, of people staying at our lodges. Not many, I'm happy to say, and usually very mild. And again, we followed the government protocols to make sure the guests are then looked after by the government, and if necessary, they've been isolated for some days before they've been quarantined and sent home. So I hope that gives you a basic overview of our own experience over the last 2 years, Simanjali.
That definitely does. Thank you so much. It was interesting to hear all these layers of guidelines before someone
so many
until they get to the site. And I must say, I did check the website of Volcano Safaris earlier, and I was able to see that you actually have even uploaded protocols for each of the countries that you operate. As you've mentioned, that they differ. So that's interesting. Emmanuel, I'm going to go back to your side. We've touched on these guidelines, on what they are, on why they are important, and a bit on the experience of implementing them. But what are some of the challenges that you face or stakeholders face on the ground when they implemented these guidelines? So I'll give it to you, Emmanuel.
Thank you very much. Do you hear me? Yes. So I don't really know if the tourists are totally aware of the guidelines, because we don't let them the time to do that. We impose the conditions to come to the ecotourism site, and we send the sanitary protocol when they book their trip and before they book their trip. So the main difference is that they have to do a quick test before entering the forest. And we inform them that if the quick test is positive, they cannot come in. So that's a very stressful part. We never had this case of having somebody coming all the way to Thai and having a positive test. Maybe that would have been a way to measure whether people were really aware and understood the guidelines. But also, they were informed about this. So the guidelines, I mean, we were applying the guidelines since the beginning of the project, a long time before the COVID-19 appeared. Like we have the maximum 6 people behind the chimpanzees, we were in masks, washing boots, keeping 7 meters distances, and now 10 with the guidelines. And so we just tighten up a little bit the measures when the COVID-19 came in. The constraints are huge. I mean, first, this thing of having people coming from very far away, taking the plane and being refused to enter the park because they're positive, that would be a huge constraint. But also, I think the main thing is financial for small projects like us, because we had to close the site also in March 2020. We closed it for a year, but we had to keep the whole team, as all these sites where the habituation of chimpanzees or gorillas is going on. We need to keep the whole team, even if the site is closed, so that the animals that are used to human presence would not get poached. So, I mean, the private sector also and our site had no money during this period, no money coming in, and we still had to maintain the full operation. So we had to find outside support for the guides' salaries. And this is not, I mean, for us, I mean, the COVID-19 is not something new, because this happened before, because of in the Ebola period, during the political crisis, we had to close the site and maintain the people on the eco guides on site to continue following the animals. So, I mean, we're still very behind in making the sites viable because of this. Another thing is, like, receiving only 6 tourists at a time is also a challenge to make the site viable, because this means that we need to have a very regular distribution of tourists throughout the year. While tourists, they mainly target the school holidays, the end of the year celebration, and the long weekends. So it's a daily struggle to maintain the permanent presence of the guides behind the habituated animals. And the stakes here are very high, because, I mean, everybody knows, and you've shown also in your video, that if you stop the permanent presence, then you leave the room for poachers. And with habituation, you make these groups more accessible, more vulnerable to poaching. So in a sense, the tourism projects can better protect a great ape population through the permanent presence, and it's shown and it's demonstrated already, but it can also make them more vulnerable if the regular monitoring is not provided. So I think in that direction, we should really think to how to support better we need to consider this ecotourism site as conservation measures. It's becoming more and more difficult to find funding for ecotourism projects as an NGO, because I think there are a lot of ecotourism sites managed by NGO that don't reach self-financing. But I think we should really be able to think on the long term that support to this project is very important and needs to be seen as an important conservation measure in fragile situations, like during pandemics or during political crisis. So I think that's the main constraints that I see. The ecotourism is really a solution for areas that are still fragile, but needs a lot of support to be able to get through all the situation that we cross every day. Thank you.
Thank you so much for that. For a lot of us, or should I say for me, when we speak of tourism, I really think of the way of the work that goes in advance to ensure that the site itself, the species itself, is ready for that to happen. So thanks for giving us that insight. Gladys, you were recently part of a research that was actually trying to find out whether prospective tourists actually know about these guidelines and whether they are willing to follow them. I would love to come back to your side to give us more insight. what are some of the insights that you got from that research that the team was conducting?
Yes, we got together in a consortium, which was led by University of Exeter, Dr. Kim Hawkins. And in it, we also had Dr. Fabian Liandetz, who was at the Robert Koch Institute at the time, but now started another institute called the Helmholtz Institute, and a number of other people, Bristol Zoological Society, and IBAP. And this was funded by the Darwin Initiative as, you know, they wanted something connected to COVID. They wanted to see how can we protect wildlife during COVID. It was a very short project. So Kim got together and also got additional funding from ACAS Foundation and Rewild. And we sent out a survey to over 1,000 people answered the survey. It was an online survey to find out what they thought about. Some of them are former travelers. Some of them wanted to travel to Great Ape sites. And what they thought about the COVID regulations, which were happening at the time. And, you know, questions ranged from, are they willing to wear a mask? When they get there, are they willing to be tested for COVID? Are they willing to go into quarantine? They even asked about vaccination, although vaccinations hadn't yet really started. And we got a lot of interesting results, which can be found on the website, www.protectgreatapesfromdisease.com, which we'll put up in the chat. And it was also a very good way to find out, you know, some people were very willing to follow the regulations and others were like reluctant to be vaccinated. Others, one thing that was very interesting is people were willing to wear a mask when they're with the gorillas or chimps, but they're not willing to wear a mask when they're hiking up to the gorillas or chimps. That's something that came out quite strongly. Yeah, so it was a very interesting study. And actually, we want to continue to collect more information from different people, and I'll post all the links on the site. But at least to show that there was an increased awareness about these guidelines, and whatever, it's been a lot easier actually to educate the tourists now that tourism has started to come back, because they're used to hearing the words, put on a mask, social distance, hand hygiene. Those are the words they're hearing just to protect COVID, you know, between people, amongst themselves. So when you say it at the briefing, they really understand it. And actually the One Health production made a very nice video talking about these regulations, both for the site, but also another one which was localized to the Windy situation, where they interviewed people who work in that area, and is played at the briefing. The chief warden is in that video. I'm in that video. Rangers, people from the Wildlife Authority headquarters are all in that video, talking about the importance of maintaining the regulations before you trek. And this is really helping because it's about a 7-minute video which comes up there and everybody listens to it. But on top of that, International Gorilla Conservation Program also has a short video that they made to get people to take the gorilla friendly pledge, which means that when you're trekking, you're supposed to follow all the guidelines and all the regulations, and you're supposed to report how your experience went. So I think we're trying to pass the responsibility onto tourists to realize that they're also part of the solution to making sure that we have responsible Great Ape tourism.
Yeah, thank you so much for sharing insights on that research. I see the team has also shared the link to that site in the chat box. I have a follow-up question that actually came from Charlotte in the background. And I think, Praveen, I'm going to take this to you, and anyone else, of course, can add. People are testing, some people are getting vaccinated, which means they start feeling that actually they're not going to be transmitting diseases. So Praveen, you can start here. The question from Charlotte is, how do we keep the pressure on mask wearing while in the forest, sanitization, when many people feel less vulnerable because they are either vaccinated or have tested negative or have heard that COVID variants are getting weaker? How do we keep the pressure on?
I think this is a very good question from Charlotte. Thank you, Simandele, for raising it for everybody, because of course, this is what we're seeing in society throughout now, isn't it? There was a moment 18 months ago, 2 years ago, when, if you like, the fear factor was so big that we were all doing all the precautions and all the the masks and the testing and the sanitization. Now, as things open, it's harder. I think it's, as again, Johannes said something earlier, this is a responsibility for all of us. So I don't want to say, oh, look, this is just for the parks or it's for the tourists. I think it's for all of us to realize that the critical moment, of course, is when a tourist is actually in the presence of a gorilla. So that last phase, when they climbed up the mountain and they are ready to have their hour with the gorillas, that's where I think, as the private sector, the tourism operators and the lodge operators, their guides, excuse me, the guides of the national park, the rangers of the national park, and the tourists themselves must be reminded that that is a critical moment and they need to mask up and keep the distance and, keep this longer distance of 10 meters. So I think it's a responsibility for all of us to make sure that happens. Because that would be crazy that at this moment when things are beginning to finally settle down, that we get gorillas in the wild getting infected in some way.
Yeah, thank you so much. So I'm aware that we've spoken so much on the side of tourists and whoever is receiving the tourist and expanded their role. But we haven't touched so much on the role of governments. We did touch briefly with the role of park authorities. And Johannes, I'm going to go back to you for this one on to what extent do governments have a role, and where you work, are you seeing that there's a lot of buy-in in protecting, in promoting, and ensuring that these guidelines are put into practice?
Wow, that's a complex question. Also, because the realities are very different. I mean, we have heard from Emma before that when tourists tend to come in the same season and you have to reduce the number of tourists from 8 to 6, it has an economic impact. But let me go into a few more details. Before the pandemic, we were really struggling making masks mandatory across all Great Ape visiting sites. Some were implementing it very well, other sites were never implementing it. Of course, with the pandemic, visitors are more inclined to accept that, and even the protected area authorities understand the necessity. So it has changed to a certain extent. But there are other recommendations, they're not that easy to implement. And also because the situation is very different, even across species. Gorillas are spending most of their time on the forest floor. So when we visit them, we get very close, and it's an issue. Chimpanzees spend a significant amount of time up in the trees, bonobos too. So naturally, you have a higher distance. So it's much easier to manage in terms of distance between the visitor and the individual. So that's an important difference. Then when you look at Uganda and Rwanda, there's a really high dependency on income from tourism. Tourism brings in the money, tourism generates jobs. It helps the protected area management authorities to maintain their operations. It creates an important income for communities. And it is a difference whether you have 8 visitors or 6, assuming that, let's say you have 8 groups per day and you reduce by 2, that makes 16 people per day, and then you multiply by all the days a year. So that's something to be considered. The same is true for Thai, what we heard from Emma. And it needs to be a plan on how to compensate for that loss and make it sustainable. So yeah, there's another point. We haven't spoken much about it. I think Praveen touched upon it, the issue of vaccination and testing. In the new guidelines, there's also the recommendation that park staff, which is really getting close to great apes, should be vaccinated. I mean, we remember all well that at the beginning of the pandemic, it was very hard for the African countries to receive the necessary amount of vaccine. But even when the vaccine is there, the capacity in countries and in protected area management authorities are very different across the African countries. So if as much as we want to encourage the full implementation of the guidelines, we also have to understand the local and national realities. So it will be a challenge for a little while. Nevertheless, we hope that governments implement as much as they can. And obviously, the next step would be to have a formal government endorsement at the African Parks Congress. So a few more months of, I think, heavy work ahead of us. Thank you.
Thank you so much for that. And I can see in the chat box, we are actually getting contributions from some of the audiences, and I would love to note just a few and encourage everyone, if you have a question, a comment, please put it in your chat box because I'm going to pick it up. Even if you are following us from social media where we are live on Facebook, put your questions in the comment section and my colleagues will forward those to me. So for example, Chloe has informed us that the Protect Great Apes from Disease initiative has actually developed a suite of evidence-based tourist education and guide training materials. And the added advantage of this is that it's available in English, French, Spanish, and also Portuguese. And Barbara, you've added a very important point that I also think one of the speakers touched briefly on earlier on the importance of actually informing tourists that it's not just COVID-19 that is dangerous for great apes, but other diseases as well. So this is something that is needed. These guidelines are needed beyond you being vaccinated for COVID or wearing a mask for COVID specifically, and so on and so on. I wanted to ask a question. I can start with you, Emmanuel, and of course, Gladys can add into this. We've touched again on the role on, what governments can do, and focus was on tourists, but it's been highlighted that these great apes, some of them stay in the areas where there's actually people around communities. What work is being done in that sense to sensitize the communities around on these guidelines as they are part of the community as well that interact with them? Perhaps I'll start with you, Emmanuel, and then we'll move over to Gladys. What work exactly are you doing with the communities, not with the tourists this time around?
Thank you. I mean, where we work is areas where that are protected or getting protected. So normally, for example, in international park, people don't get in. But for sure, there are poachers that comes in. I mean, we have awareness raising that we develop around protected areas. So we had a special awareness about COVID-19 with posters and with posters that were created by the Robert Koch Institute at the time about not simply about COVID-19. I mean, in the area we have all the diseases, but about zoonoses and what the measure that they need to take in order to avoid or to prevent such diseases. So we are working also with the hospital from Chai, from the area, to discuss about, I mean, in terms of prevention, to keep the discussion about the zoonoses that could emerge in the area. I think, and that's really particular for Côte d'Ivoire. In Côte d'Ivoire, we are very afraid of any diseases. So Ivorians are very, following the rules. So when there was Ebola outbreak in the Liberia and Guinea and Sierra Leone, it never comes to Côte d'Ivoire because the borders were closed. Everybody stopped eating bushmeat. And so, I mean, the awareness raising was great and reached really a huge number of people. And for the COVID-19, I think it's the same. People were being careful. But our chance is that it didn't reach. Our chance is that it didn't really reach, the COVID-19 didn't really reach the remote area. It stays mainly in Abidjan and the surroundings. So that was very a chance for us in that during that time.
Yeah. Thank you so much. Edis, I'll move to your side with experiences from Uganda.
Yes, well, with conservation through public health, we actually founded the organization when people in the local community made the gorillas sick with scabies. And so we have a very strong community focus. And during the COVID-19 pandemic, of course, it was a huge concern. The problem is that the mountain gorillas at Windy especially like to go outside the park to eat people's banana plants or eucalyptus, the bark of eucalyptus trees. And they often come into contact with people who are sick. And so the gorillas didn't know that there's COVID, so they were still going outside the park. And one thing that we did is we started off by training the gorilla guardians, who are a group of human and gorilla conflict resolution teams who had gorillas back when they come out. We got them to all have masks. So it's actually funded by ACA's Foundation. They all understood the importance of preventing COVID among themselves and between people and gorillas. And this was training that started with the rangers when they had to first start wearing masks in March 2020. And it went on to the human and gorilla conflict resolution teams. And then we also trained community health workers who we trained to do conservation work. We call them village health and conservation teams in Uganda. And they went out and encouraged people to adopt hand washing stations, wash their hands more often, have hand washing facilities at their homes, to put on masks, you know, social distance. They were given soap. So they talked a lot about all these dangers of COVID, and people understood that as much as it can spread between themselves, it can also easily spread to the wildlife. But one other thing that we did is we did work with Ride for a Woman, which is a local enterprise in Windy. And Ride for a Woman actually used to make tablecloths and things for tourists, really nice bitenji, but now there's no tourism and they were laying off all their staff. So we managed to engage them together with International Gorilla Conservation Program and got them to make cloth masks. And cloth masks for the rangers, cloth masks for the village health and conservation teams, for the gorilla guardians and any of the community members. And so this helped to keep some people out of the forest in spite of, you know, even in spite of not having tourists. And so these are all the different ways that we engage in communities. But something else that we ended up doing was to provide fast-growing seedlings to the most vulnerable people, including the wife of the poacher who killed a gorilla, because he went to jail for 11 years and she was very, very poor. And she was among the beneficiaries of the 1,500 people we've given fast-growing seedlings. They said they were poaching because they were poor. I mean, they were hungry during the pandemic. Money from tourism was no longer coming to buy food, and they were just going back to the forest. And yeah, so as Emmanuel has mentioned, and Johannes, Praveen, we all need to look at the issue of how do you have, you know, how do you balance the economics and the conservation? Because when you have the money coming in, then people are less likely to enter the forest to poach. But how do you do it that it's done safely, especially when you have highly infectious, you know, COVID-19 and other respiratory diseases?
Thank you so much, Gladys, for this. And I see we've drilled into very ground case studies of how women are getting engaged in the space, communities based on their interest and expertise and the skills. As we draw to an end, I saw a comment by Angelique that you already responded to Johannes, speaking about how we need, in a way, an approach that allows all the stakeholders we are speaking about to work together, sign some form of agreement in protecting Great Apes. So I'll go to your side, Johannes. Do we have case studies where such a regional approach has been taken in order to protect Great Apes, and how is that working?
Yes, thank you. There are a number of examples, but obviously the most prominent one is the collaboration under the Greater Virunga Transboundary Collaboration Secretariat I mean, that started almost 30 years ago, so we have a long history. But I think the very important element is that the three countries have agreed to implement the same rules. They actually do technical training or training at technical level and regularly invite technical staff from the three countries so that the level of education and training is comparable. And what is also, I mean, we talk about the economic aspect all the time. I find it fascinating that the three countries agreed how to deal with the transboundary guerrilla groups. So those are the groups who have been habituated in one country and then moved across the border in another country. So who is owning them and who is getting the money? And the countries agreed that 50% of the tourism revenue goes back to the country of origin. So I think it's not all perfect. There's still challenges, but I think we have seen some successes. And what we have is a functional political platform to promote collaboration. It's not the only platform, I have to be honest. We have some similar approaches with a different methodology in Central Africa under the Zanga National. With the Wild Chimpanzee Foundation, we started a transboundary process between Cote d'Ivoire and Liberia. This is very far behind. We started much more recent and with different challenges. But I think a lot of stakeholders have understood that the climate doesn't stop at borders, protests don't stop at borders, even gorillas don't recognize passports. So we need to have a regional approach. There's no way around. And the Virunga example is a very good example. It has been cited in many publications, and maybe it offers the opportunity to invite colleagues from other countries to come and see. And that's maybe one of the recommendations of that meeting when we talk about how to implement across the 11 Great Ape countries, the 21 Great Ape countries in Africa. Promote cross-site visits and see what are the challenges and what are the solutions. Get the Ivorians over to Uganda and get the Rwandans over to Cote d'Ivoire and to Nigeria and Cameroon and exchange experience and see how we can promote that agenda. Thank you.
Thank you so much again for those insights. As mentioned, we are drawing towards the end. We've went from explaining what the Great Apes are, where they are found, the challenges they face, and how these differ per site. And we've explored again the role that different stakeholders can play in saving them. We've drilled deeper into the tourists themselves, into the local communities, into the governments, the park authorities, and so on. And I'll come back to you, Gladys, and say, as we are about to close, you are a co-author to the policy brief. What are you hoping to achieve with it that has not been achieved already? Yeah, over to you.
Thanks, Emangeli. Yes, I am a co-author. The first author is Alice Baye from International Gorilla Conservation Program. And what we are hoping to achieve from the policy brief is that it's really geared towards the governments, the donors, the tour operators, and I guess the tourists, because they're the tour operators market the experience to the tourists before they arrive. And it's marketed to all the three stakeholders. But I would say that, you know, we've updated the policy brief to talk about the fact that Great Apes have now actually got COVID from people. So it wasn't just, it's actually the worst, what we feared has actually happened. And we also put in the fact that when we wrote the first brief, vaccinations were not available at all. And now they're widely available. So we add things like encouraging people to get vaccinated. Conservation through public health successfully advocated to the Ministry of Health COVID task force that the park rangers should be among the first to be vaccinated, along with health workers and teachers. And that happened. And when the rangers got vaccinated, the community members got encouraged. And when they saw other conservation partners getting vaccinated, they got encouraged. So we're hoping that the policy brief can really encourage people to do that, but also to encourage people to know that, you know, some tourists come thinking they're vaccinated, they don't have to wear a mask. I know that, you know, that the park staff, the chief auditors had to tell them you have to wear a mask, because as we know, even when you're vaccinated, you can still spread COVID. just like happened in Atlanta Zoo. So it's really there to just reinforce things, but it's also there to tell people that there are other diseases. It's not just COVID. And these regulations should remain beyond the pandemic. We keep wanting the pandemic to end. We don't know whether Omicron is the last variant. There may be another one coming up. But even if Omicron isn't the last variant, the great apes are highly susceptible to respiratory diseases. Some have died due to respiratory syncytial virus, as Barabora put in the chat, Dr. Barabora, and other viruses have killed the great apes, human metonyma, the gorillas in Rwanda. So it's really a policy brief, not only for COVID, but for all other diseases. And really wearing of masks should become the new norm for great ape tourism, and maintaining a distance and being healthy when you trek, and all those things that happen, having to take your temperature. And I also want to mention that during the pandemic, the Greater Virunga Transboundary Collaboration got together a group of stakeholders working with gorillas in the 3 range countries to develop a contingency plan. And it's been really helpful for us to all compare notes and really more effectively engage the human health sector in protecting the great apes during the pandemic. And I think there may be also on the call, Dr. Segbe is currently heading it, and he said he would join.
Thank you so much, Gladys, for giving us that insight. And we've heard colleagues, and again, I encourage you to download and read the policy brief. You can also find it in our social media pages where you can share it. So on my side, as we close and I reflect, of course, part of the key things that I've learned today was the understanding that there are a lot of threats to great apes. These range from habitat destruction to poaching, to bushmeat, and to zoonotic diseases. But also these differ per site. What is the main threat in one site is not necessarily the threat in the other, which means the solutions that are getting employed also need to differ. We did also get a bit of positive news that in as much as we've seen great apes getting covered in other areas in the world, in Africa, as yet we haven't recorded a positive case, which I think is a very good indication of the work that the colleagues who've been humbly here saying they can't say whether they are winning or not, that it is showing the results that the work that they're doing is actually working out. And of course, we got to hear some of these guidelines. They include wearing a mask, washing your hands, social distancing, as well as supporting the local economy in the areas where these great apes are found. And we also got interesting contributions that in addition to the guidelines that we know that there's guidelines that are happening before someone travels, and also there's protocols to follow when you arrive in the country where the great apes are. But also more interestingly, even when you arrive in the lodge or wherever you'll be staying, one of the guides gives you that information actually and the brief, and that you still get these guidelines and protocol recited to you and reminded to you in the field as well as you track. But we also touched that in as much as it may look as easy as simple, there are a lot of challenges in the background or constraints, so to say, in ensuring that we maintain responsible tourism, and Emmanuel touched greatly on those. And in a way, we ended on a positive note that highlights that a lot of the solutions require a lot of stakeholders to work together. So there's a role for local communities to play, for tourists to play, for governments to play, but also at a higher level. There is a role for a regional approach, a cross-sectoral approach in order to ensure that we save great apes. For myself, thank you so much for joining us today. I really hope you found the session meaningful. It was great. Thanks to all the speakers that came back. We actually had them last year. So it was great to see how the situation has changed, right? And some of the things that you were kind of foreseeing at this point have kind of came true. So all of that was interesting to see and build up into. And we really hope that this has been a meaningful webinar for everyone following. To that end, I would love to end it here, and thank you so much for joining. We would play the video one last time that kind of summarizes what is in the brief, and remind you that you can find this video in our YouTube page. My colleagues will put a link, and you will definitely allowed to use it and repurpose and reshare it again. Janvan, over to you to play it again, and thank you everyone for joining us. We hope you keep the conversation going on social media, wherever you are, so that we secure a future for African great apes. Thank you so much.
Thank you so much, everyone, and more updates with the July launching of the policy brief.
3 out of every 4 new infectious human diseases come from animals. COVID-19 is one. Ebola, SARS, West Nile and Lyme are others.
12 out of Africa's 54 countries have reported cases of coronavirus.
These are zoonotic diseases, and they are very common. Hundreds of thousands of people have died. But it goes both ways. We give our diseases to animals. When the animals are great apes, closely related to humans, the result of infection can be disastrous. In fact, disease transmission from humans poses perhaps the greatest threat of all to many great ape populations. Over and over, African primates have become infected with human disease, from the common cold to pneumonia. As a result, many endangered animals have died. Human visitors could pass on a disease that could wipe out an entire population of great apes. Tourism brings huge benefits to economies, communities, and conservation efforts. But we must protect them. In doing so, we protect ourselves. Here's how. When visiting great apes, stay at least 10 meters away. Wear a mask. Support nearby communities to improve sanitation and hygiene. Tell tour operators and governments to enforce these rules. It could save their lives and yours.
Thank you so much, and goodbye from me, everyone. Thanks.
Thanks, Simangeli, Praveen, Johannes, Emmanuel, and everybody.
Bye, Simangela. Bye, everyone.